Welcome to the Chronic Renal Failure Masterclass, presented by Mr. Nagesh Sir of ND Nursing Coaching. This is a special edition focused on mastering kidney care for AIIMS and NORCET. Let's start with a question. Which GFR stage indicates the onset of kidney failure, also known as end-stage renal disease, or ESRD? The correct answer is D, GFR, less than 15 milliliters per minute. ESRD occurs when the GFR drops below 15 milliliters per minute, which requires renal replacement therapy like dialysis or transplant. Next question. What is the most critical electrolyte abnormality in chronic renal failure, or CRF, that requires urgent intervention? The correct answer is B, hyperkalemia. Hyperkalemia is the most life-threatening electrolyte imbalance in CRF because it can cause fatal cardiac arrhythmias. This happens when potassium accumulates because the kidneys fail to excrete it. What dietary instruction is crucial for a patient with CRF? The correct answer is B, restrict potassium and phosphorus intake. High levels lead to arrhythmia and bone disease, respectively. Protein is also usually restricted to minimize nitrogenous waste. Moving on to nursing care. What is a major nursing care priority for a patient with an arterial venous, or AV fistula? The correct answer is C, auscultating for a bruit and palpating a thrill. These confirm the patency of the fistula. Blood draws and BP checks are strictly forbidden on that arm to prevent trauma or infection. Which hormone deficiency causes anemia in chronic renal failure? The correct answer is B, erythropoietin. Kidneys produce erythropoietin, which stimulates red blood cell production. In CRF, erythropoietin production diminishes, leading to normocytic, normochromic anemia. What is the relationship between calcium and phosphorus in CRF? The correct answer is C, calcium falls, phosphorus rises. Kidneys cannot excrete phosphorus, leading to hyperphosphatemia. High phosphorus binds to calcium, causing hypocalcemia, which triggers PTH release. A classic skin symptom of severe uremia is. The correct answer is B, uremic frost. Uremic frost is a fine, white, urea-rich precipitate that forms on the skin in patients with extremely high BUN levels, though it is rarely seen with modern dialysis. Why are patients on hemodialysis prone to hypotension during the procedure? The correct answer is A, rapid fluid removal. Ultrafiltration removes fluid from the intravascular space faster than it can be replenished from the tissues, often leading to rapid drops in blood pressure. What is the purpose of phosphate binders, such as calcium acetate? The correct answer is B, to bind phosphorus in the gut and prevent absorption. Because phosphorus levels rise in CRF, binders are taken with meals to bind dietary phosphate in the gut, preventing its absorption. Which drug is the preferred antihypertensive for a diabetic with CRF? The correct answer is A, ACE inhibitors. These are preferred for diabetics with CRF because they are renoprotective, slowing the progression of diabetic nephropathy. What is a major complication of peritoneal dialysis, or PD? The correct answer is B, peritonitis. Peritonitis is the most frequent and serious complication of PD, caused by bacterial contamination of the peritoneal cavity. Which assessment is expected if a patient with CRF has fluid overload? The correct answer is B, crackles on lung auscultation. Fluid overload due to kidney failure causes pulmonary edema, manifesting as crackles in the lungs. What does dialysate refer to in dialysis? The correct answer is B, the specialized cleansing solution. Dialysate is the fluid used to pull waste products and excess fluid from the blood across a semi-permeable membrane. Why is BUN elevated in CRF? The correct answer is B, kidneys' failure to excrete urea. BUN, or blood urea nitrogen, is a waste product that accumulates in the blood when the kidneys lose their ability to filter and excrete it. What is the significance of the weight check post-dialysis? The correct answer is B, to determine the amount of fluid removed during dialysis. The post-dialysis weight is compared to the dry weight to calculate ultrafiltration and ensure adequate fluid removal. Which acid-base disturbance is common in CRF? The correct answer is B, metabolic acidosis. Impaired kidney function leads to decreased bicarbonate reabsorption and reduced hydrogen ion excretion, resulting in metabolic acidosis. What causes muscle twitching in CRF? The correct answer is B, hypocalcemia. Reduced kidney function leads to vitamin D deficiency and hyperphosphatemia, both causing hypocalcemia, which increases neuromuscular excitability and leads to twitching. What is the first-use syndrome in hemodialysis? The correct answer is A, an allergic reaction to the dialyzer membrane. This acute reaction involves complement activation and can cause symptoms like dyspnea, chest pain, and flushing. How is potassium treated emergently in CRF? The correct answer is A, IV calcium gluconate for heart protection, plus insulin/glucose. Calcium protects the heart, while insulin and glucose temporarily shift potassium intracellularly. Which drug is the first choice to manage hyperphosphatemia? The correct answer is A, calcium carbonate, phosphate binder. Calcium carbonate is commonly used to bind dietary phosphate in the gut, reducing absorption and lowering serum phosphorus levels. What is the primary cause of pruritus in CRF? The correct answer is B, uremic waste deposits and elevated phosphorus. While dry skin is a factor, the underlying cause is the accumulation of uremic toxins and phosphorus salts under the skin. How do you treat the anemia of CRF? The correct answer is B, synthetic erythropoietin, EPO, and iron. EPO corrects the deficient hormone, and iron supplements are necessary to support red blood cell production.